If you've ever Googled IVF and cancer risk in the middle of the night, this video is for you. One of the most common fears that my patients have is doing fertility treatment medications and risk of cancer, especially breast cancer. It's a fair question. You are taking medications that increase your own production of estrogen and progesterone. These are hormones that your body sees every month, but when you do fertility treatments, those levels get higher. And breast cancer is common. 1 in 8 women will face breast cancer diagnosis in their lifetime. So let's review the actual evidence and research because the findings might surprise you. I'm Dr. Lora Shahine, a double board certified OBGYN and reproductive endocrinologist helping people build families for over 20 years. And I love educating. I want to review the research and answer questions for you. If this is the first time finding the channel, welcome. I'm so glad that you're here. Be sure to subscribe so you get all of my videos on reproductive health and overall wellness. And if you're coming back to the channel because you found previous information valuable, welcome back. I am so glad you're here. There are 2 other ways to stay connected and learn. You can sign up for my weekly newsletter in the description below. There's a link. And you can listen to my Brave and Curious podcast every week, wherever you listen to podcasts. And I have video interviews on my YouTube channel under the playlist podcast. Now, today we are delving into a common question and common worry for anyone that is facing fertility treatment. They want to know, what risks am I doing by undertaking this treatment? And specifically, my patients ask me, do fertility medications increase my risk of breast cancer? We're going to go over some specific topics today. Number 1, we're going to talk about why this is such a hard question to study and difficult question to answer, but the research has been done and I'm excited to share it with you. Topic number 2, we're going to go over the actual research and specific studies looking at breast cancer risk associated with infertility and fertility treatment. Topic number 3, we're going to go over risks of other cancers as well, specifically ovarian and uterine. And finally, number 4, I'm going to put it all together, give you some takeaways, and help you understand the overall findings and the research to answer this very important question for you. Topic number 1, why is this subject and this question so hard to research? Before we get into the data and go over the actual studies, I want to acknowledge that it's actually quite complicated to study impact of fertility medication and cancer risk. Here's the issue. Women who are undergoing fertility treatment can be different and face different risks from the rest of the population. Number 1, nulliparity, or never being pregnant, is in and of itself a risk factor for breast, ovarian, and uterine cancer. Number 2, endometriosis. 20 to 30% of people with infertility will be diagnosed with endometriosis, and it's a common cause of infertility and difficulty conceiving. But having a diagnosis in and of itself is an independent risk factor for some cancers, especially ovarian cancer. And number 3, hormonal conditions of infertility, specifically anovulation and a common diagnosis of PCOS or polycystic ovarian syndrome, in and of themselves have an increased risk or baseline risk of cancer. So if a study does show that there's an increased risk of cancer in taking fertility medications or doing fertility treatment, a big question is it the underlying diagnosis, like infertility, endometriosis, PCOS, like why is that person taking fertility medications? Or is it the fertility medications in and of themselves that might be putting someone at increased risk of cancer? That distinction is extremely important, and some studies really struggle to try to answer. In addition, cancer takes years to develop, so it really takes long-term, large studies to answer this question, and it's taken us a while to get around to figuring this out. The good news is that ASRM, or the American Society of Reproductive Medicine, has published an incredible comprehensive guideline in 2024 looking at decades of research and over 52 large comprehensive studies to help us answer this question. I'm going to be sure to link to this study in the description of this content because I want you to be able to find the study itself. I'm going to mention specific studies that are within the ASRM guidelines. I'll put some of them in the description below as well, but I want you to be able to find this research for yourself. Topic number 2, breast cancer and risk with fertility treatment, specifically fertility medications. This is a biologically plausible question and concern. breast cancer is often sensitive to levels of estrogen and progesterone, and fertility treatment in and of itself, especially IVF when you're recruiting multiple eggs, increases your endogenous production of estrogen and progesterone above normal or physiologic levels. So this question is realistic, normal, biologically plausible, and I'm excited to be able to share the research that is reassuring. ASRM reviewed multiple large studies, and they narrowed in on 7 excellent studies that really look at breast cancer risk and fertility treatment and medications. The conclusion, most studies and all large studies like meta-analysis or comparison with collecting a lot of data show that there is no increased risk of breast cancer and sometimes even a lower risk of breast cancer after fertility treatment. Let me share 4 specific studies that are included in this group and data analysis. The first one, Gennari, published in 2015, was a systematic large review of over 20 meta-analyses or large studies gathering and pooling data. They found that hormonal treatments for infertility are not associated with an increased risk of breast cancer. The second paper was a 30-year cohort follow-up study published by lead author is Brenton et al., published in 2014. They looked at 20 meta-analysis papers. So meta-analysis is collecting data from lots and lots of good studies. And you have power when you are collecting information from so many people. And they looked at breast cancer risk after women had taken Clomid in the past or gonadotropins. Clomid is a pill that is often given to help with egg recruitment, and gonadotropins are the shots that people typically take with an IVF cycle when you're trying to recruit multiple eggs, but sometimes people will use it with lower tech treatment. But they were looking at both Clomid and gonadotropins and risk of breast cancer. And they found that there was no increased risk of breast cancer. The way they present the data is a hazard ratio. So the hazard ratio for clomiphene was 1.05, and the hazard ratio for gonadotropins was 1.14. And these increased risks or hazard ratios were not statistically significant. So let me explain. The 1.05 hazard ratio for Clomid means that if someone took Clomid in their lifetime, they had a 5% higher risk of breast cancer than someone who's never taken it. And for the gonadotropins, 1.14, a 14% higher risk if they took gonadotropins. But they had the power to show that this slightly increased hazard ratio was not statistically significant. And that means that the difference was so small statistically, because they're looking at so many people, that change was so small that it could have just been shown by chance. In practical terms, there's no difference. I just want to make sure you understand exactly how it's presented. The third study is another long, like 30-year plus follow-up study by Lerner, Jiva et al., published in 2012. It was a historical, prospective cohort study comparing people that took Clomid or gonadotropins or both compared to people that didn't. And exposure to any of these fertility treatment, whether it was pills of Clomid or gonadotropins, did not show an increased risk of breast cancer over a 30-year follow-up. The last study I want to share with you with specifics is the Omega study out of the Netherlands, and this is quoted a lot. It was published in 2016. It's a historical cohort study across 12 IVF clinics throughout the Netherlands. The study included over 19,000 women that were taking fertility medications to do an egg retrieval or IVF, and another almost 6,000 women that were taking fertility medications for lower tech treatment. There's a 96% follow-up over the years that they followed up for this study, which is amazing. A lot of follow-up data is best out of Europe because they have such incredible systems for managing healthcare and following up things over time. So 96% of the women that were enrolled in this study were followed up with health records later. They found that the breast cancer risk was not higher in the women that did assisted reproductive technology, either with or without IVF, compared to the rest of the Dutch population. Really reassuring information. There's one nuance and something that's important. Specifically for long-term use of Clomid, ASRM points out to a meta-analysis that shows that if someone takes Clomid for more than 10 cycles in a lifetime, there is a slightly higher risk of breast cancer. And ASRM calls out in this guideline that that should be discussed with patients and should try to be avoided. So ASRM's official recommendation from this guideline quote, "Women should be informed that there does not appear to be an increased risk of breast cancer associated with assisted reproductive technology, but prolonged or more than 10 cycles of clomiphene should be avoided." So that's reassuring news overall for breast cancer. Topic number 3, what about other cancers, specifically ovarian and uterine? So first, ovarian cancer. This is very nuanced. There is weak to moderate evidence, according to ASRM, of a slightly higher risk of invasive ovarian carcinoma in women that do assisted reproductive technology. Approximately 3 extra cases of invasive ovarian carcinoma per 100,000 person years. So this is a very, very low increased overall risk, but they want to share that it has been found. What's interesting is if the researchers control for a presence of endometriosis, if that's been documented, that risk is eliminated. So it's piecing together, is it the underlying cause of the infertility that's leading to needing fertility treatment in order to conceive? Or is it the fertility treatment in and of itself? And it's important to pull those things apart and talk to your doctor about your specific situation. They piece apart borderline ovarian tumors, which have a very low risk of turning into invasive carcinoma. Those two have a slightly higher risk in patients who've undergone assisted reproductive technology. So ASRM says that underlying endometriosis, probably not the drugs in and of themselves, may explain this increased risk of ovarian tumors, both borderline, which are low risk, as well as invasive ovarian carcinoma. What about uterine or endometrial cancer? That's cancer in the lining of the uterus. What's really reassuring, ASRM says there's no conclusive evidence that assisted reproductive technology puts women at increased risk of developing uterine or endometrial carcinoma. Thyroid cancer, mixed evidence. There's some very weak, poorly designed studies that show possibly Clomid exposure might be increased risk of thyroid cancer in the future. But women with infertility who don't ever take fertility drugs also have an underlying baseline risk of developing thyroid cancer in the future. So any association is most likely not associated to the drugs themselves, as far as we can tell and as far as the evidence that we have today. What about colon and colorectal cancer? So much more common today, and it's happening to people at younger ages. Well, it's reassuring to know that there's no association with fertility medication doing assisted reproductive technology and increased risk of colon cancer. Topic number 4, what do you do with this information? What are the takeaways? I've got 3. Takeaway number 1, don't let a fear of cancer derail your plans for fertility treatment. The overall research and studies to date, after decades and thousands of patients studied, are very reassuring. Fertility treatment, including IVF and those medications and elevated baseline levels of estrogen, progesterone, do not increase risk of breast cancer. If fear of cancer from treatment has made you hesitate, talk to your doctor. It's okay to ask these questions and to talk about your personal situation, get information that is pertinent for you, but the research is truly reassuring. Takeaway number 2, address the underlying causes of infertility. That's what we kept talking about as we went through each finding and each research study. If there was ever a slightly increased risk, it was really pulled apart, and it didn't seem to be from the fertility medications or the treatment of IVF itself. It was from the underlying cause and condition: anovulation, PCOS, endometriosis, and just infertility in and of itself. So that means make sure you're being screened for your age and your particular risk factors. Talk to your doctor about your personal history and what you can do for your overall health and well-being and underlying fertility diagnosis. And don't assume that the treatment in and of itself is the variable. Ask the question and get information for your personal situation. Takeaway number 3, be up to date with your cancer screening. So go to your doctor, be up to date with your pap smear for cervical cancer, your self breast exams monthly, your mammogram when it's right for you. And it might be a little bit earlier based on your personal family history, your gynecology exam and routine testing, and ask about the colonoscopy. Routine, we're supposed to be getting it at age 45, but ask for your personal recommendation based on your family's history and your personal situation. So here's the headline and what I want you to take away today. The fear that fertility treatment causes breast cancer is not supported by the evidence. Through ASRM's 2024 comprehensive guideline and review of all of the literature and research that we have to date, the findings are very reassuring. Does that mean that there are zero unanswered questions? No. Longer follow-up studies and more information is always better, but what we have today is very reassuring. If you're sitting in fear and not making that appointment with your fertility doctor or hesitant to start the treatment that you know might be right for you, the evidence is really in your favor. You deserve to make this decision from facts, not fear. I'm going to be sure to link resources in the description. I really hope this information was helpful. Share this with a friend that you know is curious about this information. Like this video if you learned something, comment with questions that you have, future topics that you'd like me to cover, and be sure and subscribe so you get my weekly videos all about reproductive health and overall wellness. Until next week, stay brave and curious.